All right, let's get right into it. Today we're talking about two totally different ways of looking at our health. One is the one we see all the time, the one that's front and center in our minds. But the other one, well, the other one is kind of an invisible hero, a silent guardian that saved way more lives than we realize. We're going to break down these two approaches, and you might be surprised to find out which one has had the bigger, yet quieter, impact on all of us. So, just for a second, close your eyes and picture it. When I see the word healthcare, what's the very first image that pops into your head? What's the scene? Who's in the room? I'm willing to bet it's something like this, right? You're probably picturing a doctor in a white coat, the bright lights of a hospital, maybe a surgeon getting ready for an operation, or a pharmacist filling a prescription. These are, for sure, the classic symbols of medicine. And you know what? That makes total sense, because this is the medicine that we are all familiar with. It's the system we turn to when something's gone wrong, and we need help, like right now. This approach has a name. It's called clinical or curative medicine. And the key words there are a single patient. It's all about a one-on-one situation. You feel sick, you go to a doctor, they figure out what's wrong, and then they treat you. It's a system that's designed to react to a problem that already exists. But here's where it gets really interesting. What happens if we rely only on this reactive approach? Well, eventually, you hit a kind of a wall. You get to a point of diminishing returns. The source material we're looking at puts it so well. Basically, it means that after a certain point, for every extra dollar or every new piece of fancy technology we pour into just treating sickness, the actual health benefit we get in return starts to shrink. We're spending more and more, but as a whole society, we're not getting proportionally healthier. So that raises a pretty big question, doesn't it? If just throwing all our resources at treating people after they get sick has its limits, then what's the alternative? What's the other side of this healthcare coin? The answer, it turns out, is to start thinking bigger. It's about shifting our focus from that one single patient to everyone else. And this is where preventative medicine, or what we call public health, comes in. And just listen to the difference in the language. It's not about the patient, it's about a collection of people. The whole goal shifts from curing a disease in one person to stopping that disease from ever getting a foothold in an entire community in the first place. This really lays out the split, doesn't it? Curative medicine is all about asking, okay, how do we make this one person better? But preventative medicine asks a totally different question. How do we keep this entire town, this whole community from getting sick to begin with? They're two completely different starting points. Now, you might be thinking, sure, prevention sounds nice and all, but come on, it's the high-tech surgeries and miracle drugs that really save lives, right? Well, the actual data might just blow your mind. It's time to meet the real unsung hero of healthcare. This right here is probably the most shocking fact in the whole thing. Just let that sink in for a moment. Not just a couple more lives, many times more. You could take all the amazing surgeries, all the life-saving drugs, all the incredible MRI machines, add them all up, and their combined impact still doesn't even come close to the power of simple disease prevention. The classic example is smallpox. We didn't get rid of it with some super advanced treatment. We did it with a coordinated global vaccination effort. That's prevention, pure and simple. So what are these unbelievably powerful, life-saving secrets? Honestly, they're things we almost don't even think about anymore. Clean, safe drinking water, which has wiped out diseases like cholera in many parts of the world. Proper sanitation, yeah, we're talking about sewer systems, which stops countless illnesses from spreading. Vaccination, obviously, a total game changer for things like measles and polio, and even things like insect control to manage mosquito populations and fight diseases like malaria. They're not flashy, but man, are they effective. So look, the point here isn't to say one is good and one is bad. It's not curative versus preventative. The real takeaway is that we absolutely need both. They're just two different tactics aimed at the very same goal, making people healthier. And what's so wild is that a lot of the time they use the exact same equipment. Think about a syringe. You can use it to give an antibiotic to a very sick person. That's curative. Or you can use that same syringe to give a vaccine to 100 healthy kids at a school, and that's preventative. Same tool, totally different philosophy. The how and why you're using it is what changes everything. This table really breaks it all down. Check out the activities. For curative medicine, it's pretty straightforward. Diagnose and treat. But look at preventative. It's medical, sure, but it's also socio-environmental. We're talking about things like improving the water supply, public education campaigns, even passing laws to protect a community's health. The scope is just so much bigger. And that leaves us with this final, really important question to wrestle with. Because this isn't about getting rid of doctors and hospitals. Of course not. We'll always need skilled professionals to treat us when we're ill. But knowing what we now know, knowing that prevention is the quiet superstar that saves so many more lives, how do we find the right balance? As a society, where should we be putting our focus, our money, and our energy? How do we get better at not just treating sickness, but at building healthier communities right from the start? It's a huge question, and the answer really shapes the future of everyone's health.